As everybody knows, home care is growing. The movement is to get people home and to keep them in their homes longer. So that's been a challenge because the staffing hasn't changed and the staffing ratios haven't changed. So trying to find people who fit into home care, it takes a specific heart to want to go into people's homes and service them there. You have to be able to think out of the box. You don't always have everything that you need right at your fingertips like you would if you were in a hospital setting or a clinic. Having one patient to my license versus 5, 10, 15 in the hospital setting really makes me feel good professionally, but the added bonus is that you're not just seeing these people for 2 or 3 days as they're critically sick in the hospital and they don't remember who you are, they just know that there was a nurse there. You get to know these people. They become like your family.
The home care piece is a piece that we have just begun over the last year to integrate even more with what we do. And by that, everybody talks about home care when they have a short stay rehab program. But from our perspective, we have individuals who are integrated into our team meetings to talk about what we might be able to do for an individual once we give them the opportunity to choose what home care agency that they want to choose.
This is the only nursing home that I can come to on a weekly basis and be part of the team meetings, whereas the other places you get a referral, the patient's going home tomorrow and you better hope for the best.
With home care, you have that one-on-one interaction. You can get to know that patient as a person. And you learn so much more about their lifestyle and their home and their family. So it gives you a really unique opportunity as a healthcare provider. A lot of the other companies are looking at patients, especially in home care, and they're shying away from high needs cases because of the reimbursement. Schofield doesn't do that. They look at that person for who they are, what they need, what their family can help with. And it's made on an individual level. It's not a numbers game, and that really sets a standard and it sets them apart.
I like that we are a smaller agency, and I feel that when the patients receive the home care services, that they are seeing the same nurse, the same physical therapist, the same occupational therapist.
I'm very lucky because the staff has been there for a very long time and they love their jobs, and that's one of the reasons I came to Schofield was because of the history and the mission.